Hi everyone. So in the last video, I covered where the pelvic floor is located in the body and some very important functions that it serves. Today's video, we will cover some potential symptoms that may reflect problems with your pelvic floor. So in other words, you may require further investigations like imaging, ultrasound to rule things in or out. You may need to see a pelvic physiotherapist like myself. If you have any of these symptoms, make sure to consult your primary healthcare practitioner or pelvic physio for appropriate assessment and treatment. So some potential symptoms that may reflect pelvic floor dysfunction or involvement. First, you may experience leakage with sneezing, coughing, laughing, running, any physical exertion. So when I say leaking, basically a little pee dribbles out, okay? So some pee will come out and you can't stop it from happening. Second, you may pee more than 8 times a day. So typically, depending on the day, how much fluid and physical activity you have, it's usually around 5 to 8 times a day. That's considered the normal, but again, everyone's a little bit different depending on your health history and medications that you may take. But if you go urinate more than 8 times a day. Third, if you have trouble controlling your urge or frequency with needing to use the washroom. So for example, you can't delay going to the washroom. If you need to pee, you have to go right away or some of it will come out. 4, you wake up more than once a night to use the washroom because of urge, because you need to pee. 5, if you feel like you cannot empty your bladder completely, so after you go pee, you feel like there's still some inside. You may have difficulty initiating urine flow, so there may be burning or pain with urination. Next, you experience chronic constipation. So this is not always associated with the pelvic floor, but in a lot of my pelvic floor clients, they do experience chronic constipation as well. If you have pain during or after your bowel movements, you may have pain during sex or anything relating to sex. So it could be the arousal component, it could be the penetration component, it could be orgasm. And next would be pelvic pain or pressure, so feeling that pain or pressure in the vaginal, rectal, penile, testicular, bladder, or tailbone areas. Something feels like it's coming out or falling out of your vagina or rectum, so that's potential organ prolapse. There can be cramping or pain with your period that requires intervention. So for example, if you get cramps to the point where you need heat, medication, or a lot of rest, the pelvic floor may potentially be involved. If you have penile, testicular, or prostate pain. So some past medical history things as well to keep in mind. If you have a past medical history of the following, you may be at greater risk of pelvic floor dysfunction, and it may not be a bad idea to check up with a pelvic floor physiotherapist. So prostate cancer, medication side effects, if it's pre and post surgery for things that are including but not limited to appendectomy, bowel resection, colostomy, prostatectomy, removal of the prostate, vasectomy, hernia repair, surgery or trauma, basically to the abdominal, lower back, or pelvis region. Studies actually show the benefits of getting pelvic floor physiotherapy to prepare for these surgeries and also after. It really helps with the side effects. And also chronic straining from constipation, chronic cough, intense lifting, or workouts. If you have a past medical history of the following: urinary tract infections, more common in women than men, and pregnancy, giving birth or multiple births, if you have a C-section, menopause, hormonal therapy, medication side effects, and the pre and post surgery for things including and not limited to appendectomy, bowel resection, colostomy, for women hysterectomy, removal of the uterus, prolapse, vaginal repair, surgery or trauma to that general area, the abdomen, lower back, pelvis region. Chronic straining from constipation, chronic cough, and intense lifting or workouts. So these are some misconceptions. Right? It is not normal to have urinary leakage after childbirth. A lot of women think or tell me, it's normal, everything gets loose and things leak after pregnancy. It's not true. It does not have to happen that way, okay? It can change. It is not normal to have urinary leakage as you age. And it's also a misconception to think that there is nothing you can do about your urinary leakage because a pelvic health physiotherapist can help. So that's it for today's video. More videos will be coming up on the topic of pelvic health, but if you experience any symptoms noted in this video, or if you ever have any questions, definitely seek treatment or advice from your family physician and your pelvic health physiotherapist for appropriate assessment to address your personal needs. It's very important to have an assessment to determine your specific problems because each person is very different. So that's it for this video. If you know someone who may be experiencing problems with their pelvic health, remember to send this video over to him or her. Pelvic health physiotherapy can really make a big difference in people's lives, especially the quality of life, right? That mental, social, psychological component, body image, sexual health, and the quality of intimate relationships. Let me know in the comments section below if you would like more videos relating to pelvic health as well. So hit the like if you found this video helpful, consider subscribing to my channel and hitting the bell for notifications on new videos each week. If you live in Ontario, Canada and would like to book an appointment with me, visit my website, queeniephysio.com/book appointment for details. I'll see you in the next video. Take care for now. Bye-bye.